So why standard medicine really misses inflammation is because most primary care doctors are trained to look for acute disease, not early dysfunction. They are taught to ask, are you sick enough for a diagnosis? Are you inflamed enough to prescribe a drug? Are you broken enough for us to intervene? But chronic inflammation doesn't trip those alarms. Here's why it slips through, because they are missing the mark. They're only relying on outdated markers. They're using just a regular CRP, C-reactive protein, instead of a high sensitivity CRP, HS-CRP. They look at just your cholesterol overall, the total, instead of looking for things like oxidized LDL markers. They look at glucose instead of fasting insulin, or they run just a CBC instead of looking at immune patterns. And they're going to look at one marker at a time. They're going to isolate organs, one organ at a time. You go from specialist to specialist to specialist. Nobody's on the same page. And so there's no pattern recognition. And then the biggest thing we see is that Western medicine is trained to wait for pathology. So they're going to wait for autoimmune disease to kick in before they start to balance your immune system. They're going to wait for you to develop diabetes before they look into insulin resistance. They're going to wait for you to have heart disease before they screen for endothelial inflammation. And by the time conventional labs flag disease, inflammation has already been active for years, sometimes decades. A study out of The Lancet in 2018, this is a major journal, it identified chronic inflammation as a shared underlying mechanism across cardiovascular disease, cancer, diabetes, neurodegenerative disorders, and autoimmune disease.